back at Cosmetic Surgery Forum in Nashville. With us is Dr. Larry Green. Larry's a good friend and is on the board of directors for many things, including the American Society of Dermatologic Surgery. And Larry spoke here about some of the new things we're starting to think about in terms of sunscreens and coral reefs, et cetera. Can you talk us through some of those salient points?
Yeah, you know, it's interesting, Joel, that last year or a year and a half ago, a new study came out that seemed to show that sunscreen that we wear was affecting coral reefs in Hawaii and off the coast of Florida. And there was a lot of alarm and a lot of media attention about that. And when you look at it, the study was done looking at just one location in each beach in Hawaii. They didn't do multiple sites, multiple readings at each site. And then there are other studies which have not shown a correlation between sunscreen affecting coral reefs, where they sample seawater where there's coral reefs. They didn't show high concentrations of sunscreen in the seawater of oxybenzone, the ingredient in sunscreen we're worried about. And so just one study did. So you're wondering why this one study showed it and all these other studies didn't. And then a new study was published just recently from Dr. Mitchell at the University of Maryland, and she went to Hawaii and sampled multiple locations in shallow and deep water in multiple sites and in triplicate, so much more thorough than anyone else had done. And she found that oxybenzone, for example, that's the main sunscreen ingredient everyone's worried about, was present in seawater, in coral reefs, more in shallower water than deep water, which makes sense, but in concentrations of parts per trillion. Such low concentrations that the concentration of oxybenzone in the seawater and coral reefs was so low that no way it comes even close to being able to harm coral in what we know if you put sunscreen and coral together directly in vitro, not in vivo, because her setting was in vivo. In vitro sunscreen, if you shove it against coral, like you put a lot of things, and anything at high enough concentration can be toxic, it can damage the coral. But she found that the sunscreen levels in seawater is nowhere near close. So it sort of says that we really don't have that information. We have one study that said maybe it was toxic. 6 other studies say it's not, and the most comprehensive study saying that sunscreen levels, the oxybenzone levels in seawater are not even close to be able to harm the coral reefs. So the answer is we really don't know. The studies seem to show otherwise what one study showed. And I think the take-home message is we know that sunscreen can save lives, human lives. And it's important to wear sunscreen as much as we can to protect ourselves so we don't get skin cancer. As far as the coral reefs are concerned, it seems that the levels in seawater around Hawaii, where this person sampled, aren't nearly high enough to cause damage to the coral.
You know, it's unfortunate that so many of our patients, the message that they hear in the media is a very short clip, and they might actually just see something about sunscreen, concerns for coral reef, and they might be sitting out there on the beach not realizing that there's a lot of sunscreens that there's no discussion or controversy, like zinc oxide, where, you know, they need to incorporate that and wear it. Instead, they might just back away and not wear anything. And then secondly, when these studies came out earlier this year in May, when they talked about specifically oxybenzone and avobenzone and ecamsil and some of these other types of things, and we have concern about some of the absorption of these things, and then somebody might say, well, I'm concerned about all sunscreens and absorption, and they might not wear anything. We're, again, going back to zinc. We've been putting zinc on our kids' diaper rashes. My wife's a pediatrician. We've been using zinc in many different areas in irritated skin where there's higher absorption. That's just not an issue.
Zinc is not absorbed, and physical blocking agents like zinc oxide and titanium dioxide are excellent choices because they are not absorbed into the skin if you don't want to wear a chemical sunscreen. But sometimes zinc is not so easily absorbed if you're darker skinned, or men like ourselves don't want to rub things in extra and they don't want to take the time. They may prefer chemical sunscreens, and it's nice to have choices. And I think that we don't have all the answers. We do know that sunscreen, both chemical and physical, can save human lives. So we want to do what's best for us and what's best for the world, but what's best for us is to use variety, I think, and have choices. And that's why the message from the American Academy of Dermatology Association, for example, has a letter that they put out, and they mentioned that we don't know, but we do about sunscreen and absorption or sunscreen and coral reefs, you know, conflicting evidence, but we do know that sunscreen can save lives. And it's important to tell our patients, use sunscreen, wear protective clothing as well. You know, you won't want to put sunscreen head to toe, for sure. That's not smart, even with zinc oxide. That would take a long time and be not cost effective. We want to protect ourselves, be smart, and we do know that it can save our lives and prevent skin cancer.
I agree with you. And in terms of some of the other measures that people do, some people say, don't worry, I sit on an umbrella. And there's actually evidence to show that it depends what the material of the umbrella is made out, but it's not necessarily all that protective. Plus, when somebody's sitting on an umbrella at the beach, you have reflection from sand,
right.
you have some reflection from water. So it's a combination of all these things we can do effectively.
Thanks for having me, Joel.
Thanks for joining us for DermTube meeting coverage from Cosmetic Surgery Forum in Nashville.